Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in. Welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as Healthcare Now radio network. For this episode, my 239th episode, with a very special show continued, dedicated to the HIMSS annual conference from Orlando. I also have two very special guests returning with me on air today. My longtime producer, Roberta Mullin from Healthcare Now Radio, and Jim Tate, host of the popular Tate Chronicles. Welcome to the show, my friends.
Good to be back, Justin.
Yes.
Justin, it was good seeing you at HIMSS last week, and good to be online with you right now.
Yeah, you guys are wonderful. We had a great time. Last week, we talked about, just how pleased we were with the size of HIMSS. We think the number was around 26, 27, 28,000 or so. It was just great to have everybody back. The energy was real. The collaboration was real. People were just, just happy to be together, happy to be out and about. For some people, it was their very first meeting in 2 years. That was stunned. I mean, I never really stopped traveling. I, had businesses to build and things to do. And so I never stopped. But there's numerous people, that literally that was their, and more than you'd even remotely realize, that was the very first meeting in 2 years. Did you guys experience that with anybody? Roberta?
Yes. Well, one of the things is, remember that a lot of these big companies had policies.
Yep.
Right. They had lockdown. And so that's what really collapsed HIMSS in 2020. It was the big companies that pulled out.
Yep.
I think if they hadn't, it would have gone on. I don't know what would happen then.
Right. But even personally, these people had not. So there was a significant group of people that, I had not done. This is my very first business trip. This is my very first trip, even outside of my community. And so, that was just, I didn't realize, but yeah, pretty significant. But what did you experience, Jim? Anything like that?
Well, Justin, I was one of those folks that haven't been to a conference in 2 years. The only traveling that I've done the last 2 years, about 6 months ago, went to Key West because it was lobster season.
Oh,
And of course, that's mandatory, mandatory attendance. But as far as I used to go to at least 2 or 3 conferences a year, always HIMSS, but I wasn't there last year, and the year before I wasn't. So it's good to be back out, on the High Sierra riding a horse again. Yeah,
it was awesome. So actually, we have to do a show just on that lobster trip then, because I'm a huge fan. I'm actually going to Boston in in May, just for lobster. Going to spend about 10 days there visiting some family, but eating a lot of lobster. So
I can't let that go by, because in the Florida Keys, we don't consider those New England things to be lobsters.
Well, vice versa.
And vice versa.
Exactly. I don't want to say that on air, but I love Key West. I love Florida. Those little chickens of the sea thing. I don't know what that is. Anyhow.
Yeah. Maine is the lobster place.
Thank you, Roberta.
You're ganging up on me.
Exactly.
There was, let me just kind of jump out here. I know you've got an agenda, but
no, I don't.
At HIMSS, last week we talked about things we saw. I want to mention something I didn't see.
Mm-hmm.
We have come through 2 years of a global pandemic. And I don't know how many hundreds of millions of dollars have been invested in the electronic health information infrastructure in the U.S. And so all of a sudden we get hit with this pandemic, and at a state and federal level and local level, policies were having to be created on the fly.
Yes.
And the data that those policies were based on were fuzzy, to say the very least. How many people, the data that the CDC got was based on locations around the country where maybe if somebody tested twice a week apart and had 2 positive tests, that was considered 2 people. I mean, it was just all kind of data all over the place. And somebody said, well, it's too early to do lessons learned on data. And so maybe it is too early, but I hope at some time, somebody digs really down into the crisis that occurred of making policy without valid data, because we still don't have the valid data.
I do believe we are going to see much more of that come out. I don't know the results. I don't know if it's going to be good, bad, or really ugly, but I do believe we're going to see, because, trillions of dollars was invested. It was this massive global disruption. And I think we're going to learn, in my opinion, over the next 5 years. There'll be a lot of, research coming on that. So I'm optimistic.
And hopefully another pandemic won't hit in the meantime.
Thank you. I could not agree more. So let's talk about, just kind of diving in. We had a great series of questions last week, but Roberta, what is your thoughts on the best speaker that you saw at HIMSS22 this year?
So I have to fully disclose, I did not see a keynote. I didn't. I went to some sessions and everything else. And
well, it's anything. Yeah.
So really, I'd say it was Mickey Tripathi, who I kind of followed the ONC around there just because that was, I call it my beat. Well, of course, had to go to the ONC town hall.
Bosnack.
So all those guys there. I think Mickey is a great advocate of what we're trying to do. I mean, he's been in so long, and the more I hear him speak, the more I think he really is. He's the person that should be here right now.
He's the right person for the right job at the right time, for sure.
He is. And, when you look back at the ONC, I have to say that they might have got that right all from the beginning.
I agree.
If you look at all the people that they've put in there, I think they were the right person at the right time.
Yeah, Brailer was the right person to get it launched. And then, right on down the succession. Farzad was amazing, still is. Yeah.
Karen, when she came in,
she had
she had all that. Katrina, everybody that's fallen into place. And
great point. Great perspective.
Yeah. So anyway, so the ONC, that they were my favorites.
Yeah. You, Jim?
I'd have to agree with Roberta. I don't often agree with her, and we probably get into that in just a little bit. But really, the town halls, or the large meeting rooms where there was really education on TEFCA. There were some beautifully done, more or less PowerPoint slides. Y'all often hear about death by PowerPoint.
Right.
But they would do 5 or 6 slides, and you could sit there, and and after 5 or 6 slides and listen to people talk for 20 minutes, you had kind of an understanding of what the heck they were talking about. Yeah. And so it was, some great introductions to, if it's approached in the wrong way, can seem overly complex. They simplified it in a way that it made sense. So I was glad they were there, really in an educational mode.
Excellent. Cool. Mine was John Mackey, the CEO of Whole Foods. It's a very simple message around diet and lifestyles is your key to health. And I really do believe that's a personal mantra for me. I eat whatever I want, but I'm smart about what I eat. I exercise. I manage my intake of adult beverages and anything else. It's just everything in moderation. And I believe, that is a very healthy way to live. Obviously genetics has a lot to do with it, and predispositions to obviously as a significant component to our healthcare overall and our longevity of life. But diet and lifestyle is critically important. It can be 30 to 40% of your health overall, if not more. Some people could argue. I argue it's actually more. But John brought that up in a very simple way, and I think that's really important because we're getting away from it. You can't take a pill, this miraculous pill. I mean, you can in certain situations, and I'm a strong proponent of Western medicine in some ways, but just going down to what can everybody do? Diet, lifestyle, exercise, which is part of lifestyle, and that's what really he hit on. And so I really appreciated that message. And because we're getting sicker as a country and as global citizens, we're not getting healthier. We're spending more in healthcare than ever before. But that'll never go away. We'll never spend less in healthcare than we do today, ever. I'm not a pessimist. You know that I'm an optimist. However, that's just a reality. We'll never spend less in healthcare. than we do today. And we're getting unhealthier every day as a society.
That's interesting. And I'm glad you got to go see him, because do you remember when we were talking about the keynotes in our pre-show?
Yes.
We were wondering, he obviously had a place there and what he was going to talk about and stuff.
Yep.
And I remember you saying that you were kind of a fan of his. So
yes,
that's a good.
Yeah. So I was happy to hear the message. Very simple, very easy to understand. So let's dive into another fun part. Jim, what was the coolest meeting that you had during your conference last week?
You know, there are actually a couple of them. And let me first say, I have no financial relationship.
Skin in the game.
Skin in the game.
Yeah, I mean, no skin in the game. But I spent some time with a company called Health Gorilla.
Oh, cool name.
Yeah, and Health Gorilla, they have planned and plotted and towards data exchange, data interoperability. I think that they are, if they were at the roulette wheel in Vegas and red was Tefka, they're putting all their chips on red.
Cool.
Because I think they're in a position to be one of the large networks, the QHIMSS that they call them.
Yep.
So it was nice to talk to somebody and learn something. And so they were pretty interested. Just a minute ago, you mentioned genetics being part of health, yes. Which I guess means you should pick your parents wisely.
Amen. Exactly.
And so
and grandparents.
Genomics and precision health is not maybe not on everybody's front burner, but it is a technology and research that is moving ahead, and it's going somewhere.
Yes.
And it's not a dead end road at all. And I talked to a company called SEMA4, SEMA4. They're very involved in genetic testing. Hospitals use them for testing, and of course, part of testing appropriately is not just the testing, but genetic counseling. So that was interesting. And then I talked to them a long time, because I think we'll be talking about precision health and genomics. I mean, if that's not on the horizon, we've missed the boat. And then I spent some nice time with Sophia Lopez at Kaleido, and Kaleido is involved with blockchain applications, blockchain as a service for healthcare applications, and they're doing some real appropriate work around blockchain and healthcare and things like that. So, you know, there was some gold in the stream bed at HIMSS. So, yeah.
Very cool.
Sure was.
Roberta?
My coolest meeting only was kind of on a personal side. Jim and I went and saw the VA booth. They're doing a lot of stuff, but a gentleman was one. They have a lot of kiosks. Everybody that works with the VA gets a kiosk, and they show how they integrate with the systems and everything else. And we connected with a gentleman, Bill O'Toole, who's an attorney in this space that we knew and worked with 10 years ago.
Oh, cool.
So so he was, I had gotten this LinkedIn thing from him and said, hey, you know, I'm going to be at this booth, come see me. And so we hooked up again, and it was fun. That was there. And then the other ones, both Jim and I got to talk to Paul Wilder and Alan Swenson, the head of Commonwealth and the head of Care Equality. I have to say,
I'm a founder of both of those, co-founder of both of those. Yes, you are. You're way back. I think Paul Wilder's the smartest guy in this game. That's cool. I don't know. I have a big respect for him.
Just
awesome.
do.
Yep.
Yeah. Alan Swenson was interesting. It's going to be interesting to see like what's going to happen to care equality.
Yep.
Through this TEFCA stuff. So you probably don't agree with me, but
no,
Jim. I say to Jim. Jim says he never agrees with me, but yeah.
Well, I will. I would say, from a coolest meeting, from my perspective, was a good friend of mine. Howard Bird is a great attorney in the industry, knows digital health backwards and forwards. We served on the HIMSS board together and various other boards. He always hosts an annual dinner. And so that's always one of the things that I look forward to. I always get to meet other entrepreneurs, investors, and just industry peers. And so I'm grateful for that dinner every year that Howard hosts. So that was kind of my coolest meeting. Learned about some cool innovations. And also, near and dear to my heart, as you know, Roberta is the EHR Association. I actually attended their press conference. It was wonderful to be back in the room with so many people. I was one of the co-founders of the EHR Association back in 2004 and served chair of their membership for 10 years and their chairman for 2 years. And it was like a home week. And I just so many familiar voices and faces. And that just brought back a lot of just emotion because I love the EHR Association. So that was, those are kind of mine. So, it was just another thing that what makes him so special. But before I get too far, for those that may have joined a little late, I have two very special guests today. My longtime producer, Roberta Mullin from Healthcare Now Radio, and Jim Tate, host of the popular podcast, Tate Chronicles. So again, welcome back to you both. So keeping kind of the theme of kind of fun and excitement, who are maybe name drop one person each that you met with that you kind of it was great to meet with them. I mean, Roberta might be Paul Wilder, but anybody else that you can think of, or it's just great to see at HIMSS that you had mentioned previously?
I met Damon Auger. Is that how you say his last name?
Yeah, Auger. Yeah. Mm-hmm.
Right.
Of Daedalus.
Of Daedalus. And he was one of those, like we talked about, like what was the most exciting. It was about having these relationships with these people for over 2 years and not really knowing them, only knowing them virtually. And I got to meet him and everything else. So that was one. And the person that runs their whole marketing and everything else, Margarita, we've been working with her too. So those were the two that I was really excited to meet and spend a little time with.
One of the things about HIMSS is kind of the random encounters you have with people, almost serendipity. And there was two I had. The first day I was walking from the hotel on the walkway over to the conference center, and I was chatting up some salesperson who was walking next to me, and some guy was about 5 feet away, and he said, "I know you." And I didn't recognize him, didn't recognize me, but he recognized my voice because I'd interviewed him about 6 months before.
Oh, cool.
But then that was the good one. But then over on the exhibit floor, some woman, but was it? I don't know. Was it Grace?
Was Grace. It was
well,
Grace.
I don't know. You tell me this. And she said, "Well, I put your podcast on, Jim, because when my baby's screaming, it soothes him and he goes to sleep."
That's great. I love it.
So I said, "Well, I'll start working in some lullabies as a side hustle."
Grace Benton, she comes from Amendola, and she also the older kids, they tell Alexa to play Healthcare Now Radio all the time.
Oh, that's cool.
But it's those spontaneous things that happen that's really always joyous because you don't plan them. It's hard enough to plan what you want to do, so it's nice to leave a little space for just running into people like that.
Well, and that goes up to the old business adage is half of success is just showing up. Because to be honest, a lot of people don't. And so showing up and being present, showing up and being present, not just physically, but also mentally and emotionally. So I guess the only thing I'd add to that is Mitchell Fong, he runs the virtual care strategy for Renown Health. He's a brilliant guy doing big things globally, nationally, certainly in the Southwestern United States, but he's a big global type thinker and he's great. So I got to meet with Mitchell. He's always impressive. And then obviously it was great to see Ed Marks, a longtime friend in the industry and just a great CIO and strategist that we have. So those are kind of the two more fun people that I ran into and had, some initial conversations or good conversations with. That I wanted to mention, but also I want to dive in a little bit to some really cool stuff. Maybe this is controversial too. We can, have in the last 5 minutes of the show, have some controversy. I'm going to cover the predictions that Gartner released during the conference. So I'm going to fly through these really quickly and then maybe get some feedback from you guys. I love them and agree with them. So by 2025, 40% of the nation's healthcare providers will have shifted 20% of the hospital beds to the home, driven by RPM, and AI. Kind of goes back to what we talked about. For me, hospital home was one of the top innovations that I saw. And I just read this recently. So, I mean, I didn't see this going into HIMSS, but I was really impressed with the hospital home and the evolutions there. So that's one cool stat. 40% of the nation's providers will have shifted 20% of their hospital beds to the home environment, fueled by RPM and AI. By 2025, a digital commerce platform and marketplace for healthcare will connect 1/4 of the nation's consumers, payers, and providers. That platform will enable these groups to search for, and in many cases, access or deliver healthcare on demand, bypassing hospitals, clinics, and offices. That's by 2025. That's 1/4 of the nation's healthcare. That's pretty intense. By 2025, 10 major employers will be contracting with a major retailer to deliver healthcare services to their employees. That I completely agree with. I see that on the backside a lot. That's very impressive there. Here's another one. By 2025, 3/4 of the top 20 life sciences organizations will have dealt with a cybersecurity issue, resulting in roughly $10 billion in revenue losses. That I completely agree with. I think that actually might be a low number in the losses. And that just shows the importance of cybersecurity. And then finally, by 2023, some 5% of global deaths will be attributed to the lack of virtual care access. This points out not only the value of virtual care, but an ever-growing challenge to accessing care in underserved communities. Simply put, consumers are having problems finding the care they need, and those barriers are putting their lives in danger. I want to repeat that one again. By 2023, so next year, 5% of global deaths will be attributed to the lack of virtual care access. I could not agree more, and I think that was phenomenal.
Well, you said 5% of deaths?
5% of global deaths will be attributed to the lack of virtual care access.
Do we know what the number of global deaths is, the average? Do we know what that number is? I mean,
I would assume Gartner. I do not have that on air right now,
right,
but I will follow up on this conversation because I love this. I agree with all these points. I saw a lot of these even at HIMSS, but even outside of learning what's going on. But anything that surprises you there, Roberta?
Well, I'll tell you the thing that surprised me about all of them. 2025, all of those things that you said really will take an infrastructure and interoperability and being able to, have all of your stuff on the phone, whatever. And I don't believe that we're already into 2023. I mean, let's face it, that's like 7 months away, right?
Right.
And so 2025, that's 2 years. I mean, we've been working on this stuff for 12 years and still haven't made, that much of a head. How do we get in 2 more years all of those things when they really take the infrastructure that we don't have? So,
Justin, these things you read off, where can somebody find those on the internet, on the web?
This is healthleadersmedia.com. So this is where I found it. It was an art. It was actually what Gartner, our friend Mandy Bishop, Gartner Vice President and Analyst, during her presentation, virtual presentation by Philips in the HIMSS22 conference in Orlando. So it's Gartner Group. It's what they announced during their conference. I actually found it on Rama on Healthcare. I get Rama's daily feed. He pumped it out to me a couple of days ago, and I found it fascinating. I picked it up.
I know we don't have a lot more time. Read that very first one again.
Sure. Please. By 2025, 40% of the nation's care providers will have shifted 20% of their hospital beds to the home, driven by RPM and AI services.
Okay, so I was never good at math, so maybe that's 5% of hospital beds are going to be outsourced or something. I don't know.
Probably, yeah.
But and so that's going to take reimbursement, because if there's not reimbursement for that, and then the other part is
or a significant disincentive. So yes, I totally agree with you. Either reimbursement increase or a disincentive. Yes, a hit.
Right, something like that.
Yep.
And hospitals don't want that to happen.
Correct.
Unless they change their model.
Right.
So, but that's all kind of like financial, political, cultural things. It's best for healthcare, no doubt about it. There's no doubt, no disagreement there.
Yeah, and I think that
so the path we're all on these are the paths that we should go and probably are going to go. But man, that time frame is really tight.
It is.
It's quick. Yeah.
It is. I do believe that we're where RPM is today, where it's going. I agree. It is aggressive. It's 2.5 years from now. But I believe we're going to continue to see this again, I brought up hospital at home as one of the very top innovations and evolutions that I saw this year in major themes from some of the big multi-billion-dollar players. I really do believe we're going to see evolutions in that. And again, these also organizations, to Jim's point, they've got to make sure their model supports it. So either they're going to see the support, or they're going to be part of some type of global payment that it makes them a lot more money by doing this. So, and I agree. Yes. I think those models are there in a small way in some communities, but it's going to continue to grow, and I hope it does. We've got about 1 minute here. Oh no, we got to close. We always have so much fun. I'm at time. So, I want to say thank you.
Before you leave, tell us what the booth is that you like the best.
Juneau EHR. I have no affiliation. I just thought so well done. It was big, large, beautiful, and they hosted a lot of good meetings, and I was grateful for them for those meetings. But that is the best booth by far, my opinion.
But shout out to Chris.
Yes.
Do a shout out to Chris also, because he's an Atlanta guy and was over HIMSS here. Yeah, we all know him. Chris Cooney.
Yes, love Chris. Roberta, Jim, thank you so much for joining me. Great to have you on air. I truly appreciate you both taking the time out of your busy schedules to join us. And thank you to everyone for joining us today. Please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advise and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode, want to hear more, all my shows are posted on Apple iTunes, SoundCloud, iHeartRadio, and TuneIn. And you can also check out the website, justinbarnes.com, for our new content. Thanks, everyone. Stay safe.